All right, so let's have a little fun now and do another diagram or two, and we'll make these a little bit more active. So let's just kind of make up a pose here and make it a little bit more flowy and fun. So let's do something here where I might turn the, I'm gonna start with the pelvis here. You'll kind of get as it goes along. I'd suggest maybe watching it first, and then if you draw along as well for sure. Obviously my students for sure. Yeah, maybe something like, let's see, this maybe, and then coming out here and over. So we'll do like a butt and leg study. This might get us, so this might get us something nice where we have the pelvis doing this. Maybe something like that. This may be, feel that coming through. Let's see, maybe this would come down. So I'm going to draw the gesture here just to feel what I'm doing, and then I'm going to add components to that to do a little diagramming of the upper leg here in the pelvic region. Let's see, maybe here. It's looking pretty interesting, maybe. So kind of bending over, maybe kind of modeling through here. So let's see what we can do now. If we take our pelvis in through here, okay, we look for maybe dimple here, and we come on over with our crest. We've got our trusty skeletal working through here, coming over maybe. Okay, there we go. This is going to come over here. Feel that across and back down, around. Going to feel those ischial tuberosities ending about right in through here. So that's kind of, again, our box idea. Right in through, kind of like that. There's the box coming through that I'm thinking through, right in through there. Okay, and over. All right, keep it general. You can get really specific later. So the crest, the end of these posterior crests back to the sacrum, roughly right in through here, then the sacrum coming down. Okay, maybe like this. Cross. Like so. Come through like that. This will be boxy. This will be boxy over through here later on. Boxy idea for now. Boxy side of these crests coming through here and here, up and over the the ilial wing, over and through here to there, back over into there. So first superior crest through here. Okay, and over, remember that stepping down through here. So this will have to go a little bit lower, I can see that. My conception, here's our center, true center. Our spinous processes, and then of course the coccyx down. And through here, coming over and downward, like so. I'm just going to generalize this for now. Keep it kind of blunt. A little bit. Side part of my pencil coming through now with the ischial wing. Okay, then back over. Just tilts that way. So a lot of times I'll feel these points and then I'll bring them over now. I'm bringing it over here. That's why it's nice to refer to the skeleton. This will curve in. You'll feel this in. Okay. So these are not finished the tuberosities yet, but they're getting close. So this comes in now of the tuberosity here, okay, and then downward, and then downward. Of course, we're going to attach these to the back of our leg and through here, and then we can come over to the acetabulum, and we'll see this kind of close, like that. That'll be close. We can see maybe that open. That's where the femur head will emerge. Then through here we can see that emerging through there. And then we'll come back over on the other ischial tuberosity over and through here. Kind of at a 45 too as well from the inside, especially. and then out and through. Bring back up these little legs where the biceps, femoris, and the semitendinous and membranous will attach. Now the acetabulum, you can think of it almost this like a curved cylinder coming across. See that? All the way over, all the way over. That's kind of how I see it. And the acetabulum ends, comes back in, and then we get to the ilial wing back over, and we've kind of got what we needed. This is come back through just a little bit. See, I've kept it broad and a little bit, not too, what's the right word here? Not too detailed and too finished. That's going to be enough. These tuberosities I'm going to make an issue out of here. I'm going to make them so we see what we're going to connect through these later, right in through there. So that's probably enough to get us really going with our study. Now let's put on the femur further. So I'll feel the gesture down of this leg and probably to here, coming through and over, and this is where we'll feel that femur ending and coming through. So we can say, okay, that's where it's going to cut off, and we're going to see that back part of that knuckle. So what we'll see here now with this here is the kind of the downward trend now of the shaft part of the neck, right? And so we're going to see, like if we flip this over, this would be right, because I've been using the right leg like that. So kind of see what I'm thinking, show you what I'm thinking about. I'm drawing it in my head, but also just referring over to my skeleton and referring to what I know, just to help you out here, just to see how this can be done. One way to do it, in through here. This is kind of a quicker sketch way, but structurally pretty sound. Then I'll get over here to the great trochanter. Over and through here, that's going to be important for abductors on the back part, if we saw through that. Like so, okay. Get this out of the way. Then, you think about that simple tube. That's probably going to be a little longer, maybe to here actually. All right, don't worry about erasing it. Just work that tube back through here and over. Down, okay. Keep that down and through, maybe like this. All right, so this back of the leg would feel like this. This would be where it was coming, I'm thinking, coming through like this, okay? And then it gets boxy. Glute was going to be now over, remember that over here, okay? This is the back of this box coming down, the volumetric figure. So you don't want to forget that for sure. Now we're going to see with this femur here, we're going to start to see this. So this is the linea aspera, right in through right in through here a little bit. This is going to come over now. It's sort of going to kind of come over, right? Start to get thicker through club over here. Okay. Around and around. So this is going to come all the way like so, and then around like that, and then kind of box up into here. This will be kind of the top. So I'm feeling this, okay, for now, where those condyles are. Okay, and you can kind of mush it back a little bit to make it a little bit mushy and to keep going with it through here, like so. Over. There's the top there. There's the condyle head inside. Okay, and through there. Remember, this is the lateral side on the outside. Lateral side on the outside there. So we're feeling this lateral side. This is kind of a flat area to that, right in through here. Okay. And then downward, over to the top here. And then through the side area, over. And then we get the other condyle. It's going to be a little lower now. Coming through and over, so a little bit more knuckled. Nuance, it's a better view now. Okay, coming through. There we go. Really work those tips between broad and the fine point. That's why drawing from the draftsman position of the palm holding method is a really good one to have. Not for everybody, don't worry about that. Now we're going to get the tibia fibia over here, and we get a little bit of this boxy planar view for now, like so. This is going to come in Okay, we feel that coming in. And I'll just get a little bit of it as it comes down. Keep it boxy. This is wider out here to about in through here and over. Cut into that line and downward. And then back, it's going to get shaved in. And the fibia now, out here, sitting more on the back part, will be here and downward. It'll pick up that edge. And through there. All this can be kind of shaved down. Just tone it a little bit here. And just shave that back so we can start to see it emerge. And put our forms on top of that. Now remember, in through here will be meniscus discs, right in through your cartilage, articular cartilage that will run about here, up on in, run about here, and up on in and underneath and sit into these meniscus discus, the disc pads. The medial here, and of course the lateral. They're on the outside and through there. All right, we're feeling pretty good now. So let's start to take our muscle forms and start to work with this. So we've got this feeling right now of our leg, right? So I like to get that feeling of where that glute's going to be here coming over, right? Going to catch on part of that sacrum in through here, and then downward, beyond. Feel this. We know that's going to feel over to the linea aspera, down a little bit lower where that band is, and then also over on that trochanter. We won't see the medium. So we're going to feel that. So right now I'm just getting a feel for this leg here, and then underneath, of course, the biceps femoris, semi-tendinous, semi-membranous together. So all this, let's just take it all as a box. Watch this here. Okay. Coming around now, we know where that's coming around the other side. Over to here, box it out. Where does that box end and side plane begin? About right here for us, and up and over. Then we come over to the trochanter, up and above, to get to the thigh and over and down, and see how we can feel now this downward trend even further. So there's our box. So we're going, can you feel that? We're coming across here and then going back across that way. That's important to feel that. Feel those discs. Get those meniscus discs in there. All right. Okay, so let's start to put on some forms. What shall we do first? How about the biceps femoris? How about that? And this right in through here, the ischial tuberosity would be more like that. Feel that. So let's put that on first. We know that it connects here. Okay, we see that. We know that this muscle is going to come over, bulge now. Okay, it's the back of the leg. It's going to bulge like so. It's going to come down a little bit and bulge out. We're going to feel that surround. Okay, then we're going to feel this turn. All of them together are going to feel this. They're going to feel like this. Now, depending upon fat deposits, but I'm just drawing this out of my head and using skeletal reference. And I've got my écrasé handy, but it's in a totally different position. So you have to use you got to use your head, your imagination. So I know this is going to come down, and this is going to attach back here, isn't it? Over and on the side down and through the back down part of the tibia in through here. Let me recatch the fibia just a little bit. So if you're at a school, if you're like us, we have a skeleton or two. It's great. If not, then you can use photo reference. You can do a lot with photo reference too as well. Here we go. All right, so let's work on the biceps femoris now. Attaching here, tendinous here. This is the semi-tendinous and membranous together, roughly. They're pretty much, you can think of them together now. So instead of 3, you can think of 2. Now we're getting the head of that here, okay, coming over, in through, and down around. I will put the vastus lateralis over through here, so we'll have that coming over here. So don't worry if we can't come all the way over through here. So we have this now, biceps femoris, and then we get bulgy right about in through here and end it, right? Okay, and then we get that longer, straighter kind of tendon down. That's going to come over. And then that's going to feel nicely coming over the condyle, lateral condyle, and down onto the fibular head, right in through here. Remember, that can't be, this is it's got to be behind a little bit. Because if it was in the middle, right back in through here, we might see the patella a little bit, will be the iliotibial tract. So just keep that in mind as we're working through. All right, so let's get a little bit of this going. Okay. Work that kind of muscle fibery little rendering kind of look that we do. We teach a lot of, I've seen a lot of people, when I was a student, some of my professors taught this way, this kind of chalky way. I'm going to try to do different materials as we go through there. For those of you that learn a little bit differently, I wish that would have been the case sometimes. I wasn't as strong in some materials as others, and I had to work. So I was finding the material. So whatever material you're best at, if you're, especially as a student, then feel free. Unless I tell you otherwise with my students, that might be a different story. So that's not always true. All right, so biceps femoris, semi-tendinous, semi-membranous back on the ischial head here. Okay, so we'll get the semi-tendinous and maybe a little bit of the membranous bracket through here, coming over and down through. They'll come over and pop underneath here. Okay, like roughly like so. On this side over, and you'll get this little opening. Now, a lot of times you see this little line, don't you? You see this little crease of the skin. It will look like that, and that's totally fine. That's part of the condyle. Condyles and the femur bone back down there, and then some material too as well. We'll keep our little diagram underneath alive over here as well. Okay, so we have that semi-tendinous on the run, back down, splitting through. Here it is. Through here. Semi-membranous. And they'll both cascade down on this side. And they'll relatively disappear from our view there, so we can get this bulging of the head here. Most of the time, it'll just, like in very developed people, it'll be just two heads. So we see this coming through, and then around. It's fun to be a little bit more dynamic with the position. We got a little bit different view and returning a little bit as well. So we have, because you want to be able to see it from many different views. Let's turn this in like so. Okay, so we've got the back flexors, don't we? Let's get, let's throw on the vastus lateralis. So we're attaching up and through here to the trochanter, aren't we? Right up in this area. And then we're going to bulge, come in. We feel the trochanter out here. Okay, that's bony part. We've got to leave that a little bit bonier, right? So even though the iliotibial tract will come over there, then we're going to come down, and vastus will immediately get vast and come on in like so, and kind of come down, feeling that curvature of the leg. Here is a pretty vast leg, and out, so vastus lateralis. And we'll come back in and come on down to that the patella in through here. We might see a little, just slightly to the side of that bony part underneath here. If anything, will be right in through there. So we'll get a little bit of that coming through. So we have the vastus now lateralis, the bulging part over and through here would come across in this viewpoint. So we'll get that opening. Okay, like so. We'll see that around and kind of down like so. There we go. Get that coming through. Okay. Get that to turn a little bit. So we'll see those differences of those muscles coming over. And we won't get any of the medialis for sure. All right, so we get this now, the biceps femoris tendon is here, remember, right in through here. And you're going to get the iliotibial tract running along this edge. And so what you will get, it'll start to bend here, come down, and be more medial down in through here. So there'll be a little space. Make sure we get that in between, right in through here, raised off a little bit. See the difference between those two. It's important that you get that in your drawing, right in through there. So we have that. So we got a big bulgy kind of form. Now let's go ahead and just do the outline of the glutes so you can see that a little bit stronger. I'll put that on a little bit more so we get this dimple right in through here. The erector spinae, actually, we can start to feel that over, can't we? Right in through here, we're attaching down and over. So the spinalis, the longissimus, in the iliocostalis, right over and through, right in through here, coming down and over, sheathing over. Of course, the lat will come over, and the oblique will be up and over here on the crest, right? So we can feel that coming through. It's kind of a nice feeling to feel that coming through. So we'll just kind of lay those on, sheath those underneath. Now the glutes will come across now and over. So the medialis, the medial glute would be about right in through here, coming out and over and down. Now to the great trochanter. And you might get a little bit of the tensor, not a whole lot, maybe in through there. So I'm just going to indicate those with a little light orange for now. And now I'm going to get the glutes, gluteus maximus coming over, sheeting over, coming down through coccyx bone, running through there, downward and over. Now a little bit longer, feeling that material coming through. We might get a little bit of fat pad in through there, not a whole lot. We get that feeling. This is going to come over now and come through this way. Remember that linea aspera is going to want to come in. This will be tighter probably. Fibrous band will come in through here, will kind of come over. So let's feel that now over this material to the trochanter. Remember, right in through here, coming up. And then we'll feel that the bone in through, right in through here. Okay, right in through there. Let me go ahead and sharpen as I'll talk a little bit further. So when you're doing these, any kind of diagram that you do, you want to keep in mind that you're in perspective. You want to keep in mind of your positioning, your proportioning. So it gets a little bit more challenging, but it gets an awful lot more fun as you begin to work your forms around the models. All right, so we got round back and through here so we can start to curve and feel this coming over, right? Coming over through to the trochanter and around it and through. So we feel, you can see the buttock now coming through and around and over this way. So we can wrap all this material and gluteal fiber really strong. Kind of feeling it across to that trochanter, right in through there. There we go. Whoops, I broke it again. It's time for the black anyway. Okay, there we go. So we might even get, this might come out just a little bit further to play off that underneath. So we'll get this under here. There we go. Like so. Trapping over that trochanter. Trapping over the pelvis through here. And we've got the cleft or the split through here. This will probably, if this was leaning down maybe on a bench or something, maybe this would flatten out this gluteal material here, maybe so. Maybe something like that. This would dimple over maybe. Get that process coming through, like so. And that's probably most of what we get. Let's bring this over and through here. We feel that through here. Biceps femoris. Here's kind of our center line. Through here, so we feel that underneath. And here's where we might get some fats. We might get a little bit more of the lateralis through up a little bit. You have to adjust as you need to, just to get the shape. If you finish out the line, you might get a little bit of the sartorius coming all the way over from here and over down. And of course the tensor here. This tip, just to kind of tease that back and over. Here's where our bone was, and through here. So let's put maybe the light source over through here maybe. We'll come down. This will start to feel this merging over. So the whole thing here will be a tube coming over. Then if we broke rank on these muscles a little bit, meaning here, right, to here, okay, to the lateralis. So the femoris to the lateralis and over. Okay. Tendon on this side coming through and around, over. Make that feel better and through here, look better. There we go. So we get a diagram now on the buttock. Through there. I think we're just about on our way. If we added a little bit of the calf coming through and out, it would look like the gastrocnemius. It would look a little like this. Head out through here. And over to the soleus underneath it. Like that. And we'd be on our way to Wellville, to Drawingville. Okay, so this comes down. You can feel that coming down and through. This will come over now and connect into here to that linea aspera. That's important. So to come down, this comes underneath a little bit more. So you have to adjust to make it look right too. You have to be mindful of that as it comes around. And these contour lines will come in. They want to close in and keep on coming until they get to this area of the trochanter. It pulls in, not quite to it. So we've left ourselves nicely this little part of the trochanter popping through. This material on top could be tensor fascial lata through here, but that's going to pop out and over. So that's going to be important. This pops under. This could be, if it was a male, it could be the testicles and through here. Depending upon which way that leg goes, I don't know. I'm not thinking that. This will come around a little bit. Through. Like so, in and over. And over. And let's pull these fibers on in a little bit further. make this a little clearer read. Into this trochanter area that we want, through here. This would come over, this oblique could come over and through. So this would be part of the spine through here. The other oblique, excuse me, the other glute would be here now and around. Get that end here. I will make that male, so those will be maybe the testicles and through there, to here. To that trochanter. This is just contouring around to get the feel of that system and kind of push all that anatomy underneath it and back. And this tends to be right in through here. We get that trochanter, that gluteus medius area, a little bit more of a dimple, kind of right in through that area. So we'll kind of kill this out as a line in through here. Get this going so we can really see this coming through. This head would also bulge out through here. Okay, and then down. Not sure where that would. This fibia would be in, tibia fibia would be in more that way. Okay, I think we've just about almost got what we need here. I might say right in through here where if we had a little bit more light going, this whole area might get a little bit moved in terms of the shadowing, and then I'll put contour lines back on it to give this directional flow with a little bit of shading in tone. Right in through there. That gives it, it gives it a more proper kind of gluteal look through here. As we're coming across here straight, this wants to go down through here straight over, kind of into this sort of divot that you get on the side. This gets a little boxy back into the trochanter here, and then outward, and then over and back. Going back towards the front of the pelvis. You might see this kind of emerging in through there. Okay, so I think we've got what we need now in our study. And then we can go on and do maybe a couple more of these little fun moving diagrams. See what else we can come up with. Okay. So lastly, one thing I want to show you, I'm going to come back on camera here, is I wasn't satisfied with this vastus lateralis. See that? It's just too bulgy for that look. So I'm going to change it. I want to show you that you're in charge of changing what it is you may or may not like about what's going on. So what I'm going to do is, see this line here? I'm going to flatten this a little bit. That should be a little flatter with that muscle, much flatter. So this is going to feel more like that. And that's going to give me a nicer design line. So I wrote design line here, and that's good. That takes precedent over anatomy. So anatomy is one thing, but don't let it get in the way of your design. So I'm going to throw that out there, and I'm going to put a little bit of background tone here, so we can kind of see that a little bit better. This design line coming through a little bit. I think that's going to be a nicer look. Grab a little charcoal here and let that take this back a little bit so we can see a little bit better. It's a much nicer line, isn't it? Right into there. So this is a good lesson too in anatomy, but also in drawing, is to allow the design to take precedent over. But you know, fair warning, you've got to have some experience with it. I may not have experienced that, but the more I looked at it, I thought, you know, that needs to change a little bit. It needs to alter, I think. So that's a much better finish for that anatomy coming through. So allow your design to drive the anatomy with your pose, especially when you're working from imagination, or you're using imagination and you're using some anatomical references to help you out. All right, so I wanted to get that point across with our finished study. All right, let's go on further. All right, so we have, I think, an even more challenging kind of pelvic drawing that we can do maybe, and also with the legs, another diagram. So let's try something here. Sometimes what I'll do is I'll take some reference material, just my pelvis here, and maybe start out a little bit with that. Let's see what we can come up with a little bit. And this can be something you can do, you know, on your own later on, once you kind of do these diagrams as well. So maybe something here, thinking like in this direction would be there, maybe downward, a little tilted up and over. I'll show you what I'm drawing here. All right, let's take a look. So let me draw it out and get a feel for what I'm doing. So these are good to make up when you start to feel like you've got something, you got it under your belt a little bit. You can start to feel a little bit of more confident maybe in your constructions, and do some anatomy learning on your own. So we're focusing on the upper leg through here. So I'm not going to draw all the pelvis. We're not going to need it. So we're going to draw a basic kind of box shape for now, and then start to get the gesture. So you know the acetabulum would be out roughly in through here on the other side, over in through here. You know, one thing to remember, they kind of pull and push a little forward opening in through here as they move through. Okay, so we feel that. So we're going to feel this gesture now up through here of the femur, first thing, to the end of the condyle. So here it's kind of like a box coming up and over. So we'll feel that just where the knee will split and through. So I'm going to get kind of a feeling of where I want the leg gesture here. This will come down a little bit. So we'll get some nice views of the adductor muscles possibly up in through here a little bit as well, coming through. So get down maybe to the femur here, you can get through too as well. So we get the feeling of the leg coming through, kind of this tube, okay, and through here. That might be a little long and through, right in through there. So we feel this maybe coming across long, maybe even too long even through there, maybe through here. And keep it loose and gestural. This tube going in through here, feel the pelvic crest in through here. Okay, coming down and through, maybe over the center part here of the form. Downward. Down to maybe the end of the femur through here, so you can box like through, leaning a little bit more this way. Okay, and just indicate the leg coming down here. Maybe indicate the leg, maybe coming down here like so. All right, so let's slow it down now a little bit and get a little bit more of the parts in through here. So we'd have the pubic area, the pubic crest, and the pubic bone in through here with the symphysis, pubic symphysis in through here. Okay, ischium would come back, so we'd be tilted back quite a bit. In something like this position, we're kind of looking at opening up a little bit for us like that. That's kind of what I'm visualizing in my drawing, so you can get a feel for this. So keep it real simple. This would be up and through here a little bit. Of course, this would be pushed a little bit through here and over. Okay. So we'll get those pubic crests coming up through here. Bring this notch over. Okay, get a feel for that. So we're underneath the inferior part, in through here. Then we're coming up to the superior part, which raises up now here and here. So we get that feeling up above, so we're in perspective here. So we'll top this out here and across, okay, like so. This will come over, okay. We'd have the oblique starting to come down, maybe get a little bit poked in through here, come around. Obviously the rectus abdominis muscles would start to come in through here a little bit, so we'll just keep that like so for now. And we're coming up here to the crest, maybe a little bit higher over, maybe right to there, on up. Really start to come up and emerge in through here, like so. Pushing that over. And this is going to top out now back in through here, crest out here, then start to come in and down and through there. Back over. Of course, we feel the back end of this coming over. Of course, we won't see this. Well, if we do, let's see, if we have our top crest in through here, over secondary here, then our top, the interior superior part of the crest, then we'll come over. There we go, like so. Got myself lost for a moment. Oblique in through here. There we go. Okay. So the back would come over. The oblique might feel something like this for now. Emerging in through here, so we can feel that. And then the rectus abdominis a little bit. This top ears, we might even feel this coming through a little bit, kind of like a box. We start to feel that coming down. This we're going to push. I need to push this now back a little bit where the acetabulum, remember the acetabulum in through here. So we're looking down on it a little bit further like that. That could be pushed just a little bit, somewhat back. In through like so, and then down, of course, and around. That would feel there. So that's starting to feel pretty good in through there. So let's get we'll get the leg form, clean this up a little bit, and let's put on now the femur in through here. So we'll see the head emerge just a little bit out of that cartilage function in through here, right? Coming down the shaft in through here of the neck, downward trending, and gets a little bit wider as we come out, okay? Right in through here. Okay, so we're working on the left leg, so it's the opposite leg, but just to get that feeling of what we're looking at, that downward trending part of that nobule, up the neck, and the head and through here, and then it gets rounded. Okay, and then we'll come down, start to feel this coming down a bit to get this trochanter, boxy trochanter in here, right? Get the side of it through here. Remember the lesser trochanter, probably not see in this particular view. Okay, so we get the side of that femur. Now we get this curvature coming in like so. We want that curvature down around the side of the bone, outward, downward here, downward, downward, downward till we get to the condyle. Now we're going to be in side perspective here, like so. So downward here, this tends to get a little bit bulgy, or right in through there, and then we get side perspective. Okay, coming through here, and then we're thinking of now a box right in through there. So I'm almost out of space here, we'll get that in. So we're thinking of a box here where the condyles are. We're going to keep that simple, and as this turns around in through here, right, we've got that club head kind of feeling like so. So we get that across in through here, the condyles, keep them really simple for now, right in through there. I'm going to leave off actually, well, maybe we should leave the patella on a little bit. Now this gets boxy and turns, okay, through here. So that patella floating right in through and over to tibia. right? Remember the fibia underneath here, try and get her in, and the fibia would be down there. Have just made a little bit of room in there for us. So there's the bone coming out there. Let's take on the other now, other leg, and let's see what we can do here. So the feeling of this will be a little bit more this angle, because this one is here as a tube, right? So that angle goes back that way. Okay, and this aspect now is pushing now this way in the general kind of axis sense. That'll get covered up a little bit. So this whole area, if you think about it volumetrically, right, we're going to have the biceps femoris going back, and then the abductors here a little bit later, and you'll be able to see them right in through and up in through here, something like that. This will push this up. We're going to get this straightening here, and we talked about that earlier. If you've been paying attention, the 3-finger gap, and this straightens up in through here, the rectus femoris a little bit. So we'll get this coming through. We'll probably get a feeling now, and I say probable because I can change it. So I can always change my design line for what I need. This is going to feel like this, and then this is going to, I'm going to make this a tube. Like this. This is going to open up, and we're going to show that across, because we're going to get that. If we made this into a box, we would feel this, and maybe feel this coming down. The tibia would come down, and fibia would come down. This would start to get maybe a tilted box, kind of like that, like we were slicing off. So sometimes I think of it, I'll give you two symbols here. I think of it as a cylinder, and then there are other times I think of it as a box coming in through here. This is kind of our top plane. So this pushes, see how that push around and turn, and this comes down. So we'll just throw this on really lightly, because we can make it darker later. We really get through this, we'll come around. So we get that feeling of that volume. So kind of a volumetric figure of the muscle forms. We can start there first. Now, coming out of that, we might start to feel, I'll just do a little bit of the link through there, because we haven't talked about the calf muscles are the lower part of the leg, and we'll talk about, remember that tendon, the sartorius, is going to come up all the way up through here, remember, and it's going to curve over later on, and it's going to give us this feeling with the gracilis coming through, remember that, kind of in through here, and so we're going to feel, it's all just estimation right now until I get a clear idea, something like this coming down. So we'd feel the tibia and fibia kind of emerging out through here, and then we're going to get this calf muscle coming back. And then we'll talk about the gastrocnemius and soleus, and they will emerge underneath, actually, the upper leg muscles. That's what I'm trying to say. Sorry about that. Coming in, this will feel something like, probably like this for now, and then downward. And on down the shaft of the bone. So we'll just leave it probably like that. That'll be good enough for there. And then over here, the angle of this leg coming through, we're going to feel this kind of tube-like form. We'll feel the abductor pulling out. This will feel thick and wide. This could probably come in a little bit. Okay. All right. We'll probably feel this come around and through. This might feel outward like this. So I'm thinking about a downward tube now, a box across the knee, here like so, okay. Over and across, and then where the end of this lateral condyle is, it's a nice place to turn the box this way. So I can turn it now here, right, and go back that way and feel that coming through this direction and make that a boxy form, and right in through here we can start to feel that coming down. So there's kind of a nice downward trending aspect. This probably comes in even further with the glute, maybe around and then down. So we're getting a feel of the actual design of the form before we break in the individual muscles. So we kind of thinking about grouping them all together before we get that. And we can make this more volumetric. We know that where the pocket of the abdominal muscles tend to create, the rectus abdominis muscle tend to create a side plane as we come around, and in the obliques, or the front plane, the obliques turn turn around and through here, and it turns to a boxy kind of side about right in through here on the cresting points, right in through there as we go forward now. So, and then this, as we turn through here and over already, see how that makes a nice turn now in this direction. So we're really cooking now. All right, so let's start to now break these forms down into muscles and work on our anatomy a little bit. All right, so we're coming up here. We know that the rectus femoris, we might see at this point over here, we might probably a little bit higher, we might see this rectus femoris. Remember, it attaches to the secondary crest, or what is the inferior superior crest in through here. So it's going to attach in through here to help lift that leg up. So we're going to feel this rectus femoris coming up here, and we're going to feel this come out. This will be straight because we've got a little bit of the vastus lateralis, and of course we're going to have the sartorius later on coming over here, and then we're going to have the tensor fascia lata coming down. So we might get a little straightening like that, but this is the real true 3-finger gap in through here. So I'm going to write that here, put a little dark line here, okay, and into here, and just put 3, and that's that straightening of that form we get a little bit. So the rectus femoris now, here's the bulk of the tip of the muscle, and of course it's going to attach tendinously right in through there. So we're going to get this. It's going to come over and start to peek out. Probably, I'm thinking about design now. We're the designer of the drawing and the forms. Here, come up over and start to end about right in through here now. Okay, so we start to see that coming through and over. Now this is going to turn over, so we get the outside here of the rectus femoris here. Okay, and we know that this tendon is coming down. So what we can do is draw a little bit more now of the femur coming through just to help out. So that bone would come over on this other side, right? Come out in here. This will get complex, so I'll kind of keep it broadly drawn here, okay? Look at that nice curve that comes over. And that condyle now is going to come down and box over a little bit and feel like this. I'm going to have to draw this stronger. This will come down. So it's going to feel like, this is the proper leg too, so I can bring this over. It's going to look like that, okay? So we're going to have this position more like, let's see, that's what I'm conceiving, kind of like, see how I'm conceiving that? There we go. So I've got a nice curved design of it through here. So maybe I'll leave that. Can I leave that here in the camera? Let's see if I can leave that for you. Kind of, yeah. Look, that's not in the way. That helps me out too. So we have this coming down, then we get the bulk of the femur here coming downwards, okay? Boxing out, here's the front of it, right in through here, okay? So we get a little bit of that turning. So that's going to move in this direction over. Okay, so first thing I'm going to consider is a box. Of course, we know later on that that curves, and that will be curving this way and through here, maybe a little bit smaller, like so, okay? Then we're going to get, just indicate the condyle for now, we're going to get this coming through here, this coming through, here's the front, over, here's this one in perspective like so. And then we get this rounding and over and through and then up. That's a little long. Right and through and out like so, like that, okay? Now the patella will go on top and float out more here. It'll be separated at a pretty good distance by cartilage, tendon, and ligament material, and be right in through here now. So there's our patella, not patella, but the patella right in through there. Then we can get, once we get that, we can get more of the tibia through here coming over, okay, like so. Then boxing out here, kind of rounded and boxing out and then downward. This wants to come in like so and get this side tubercle here, because we know we're going to have this notch of the tubercle right in through there. That's going to help to attach the patellar tendon through there. This is a nice side plane for now. Okay, I'll make this clear as we go through and add our muscles. And then we get down to the length of the tibia, and of course the fibia, we might get a little back here. It's in the back. We probably actually won't get any. So we won't get any of that over there. It makes it a little bit easier for us, and that'll go back in space there. All right, so we have that. Now we can start to be even more clear with it. So I feel pretty good about the rectus femoris in through here. This is going to be sheathing. Now, these will be coming across, okay? Coming across, and the trochanter is going to be back in through here. We won't see it as much. This will be sheathing across here, like so. And this muscle will end roughly in through here, kind of come down, bulgy, maybe bulge out a little bit, maybe. Let's see what I can come up with. You're going to have to work on your design. You try that through here. So I've got my handy écarté for help, and that's in a very different position, but it helps me just conceive of what is possible. Okay, like so. All right, so we have that. We know this comes down, right, to a tendon here. All right, and over the patella completely, covering it, sheathing it, and it's going to come down to that, hitting over that ligament in through there like so, nicely. Okay, so we have that. Now this is going to start to feel boxier right in through here as it comes through, kind of like a box, and we'll get more value tone out of it. As we turn the side, I'm going to have the light source coming from kind of the top, maybe to the front a little bit. Now the medialis is going to attach. Remember, this attaches at higher with the rectus femoris in through here, so this is going to feel a little bit more like this way, okay, attaching over. Now the medialis we could get to, it should sit underneath there. This might feel even more bulgy. The medialis will sit lower now, getting closer to down towards the end of the condyle. I'm going to make this a little bit smaller. It's a little large for my taste. There we go. Always change if you need. So the medialis is going to come down and slide over and underneath and be right in through, pocketed, possibly about right in through here. It looks like that would feel pretty good. Kind of right in through there. So there's your medialis, vastus medialis, rectus femoris here, right? Really heading out in through here. We haven't seen a feature yet, a bipennate part of the rectus femoris. I'll mention that later. I don't want to confuse you for now, but it'll be something where the rectus femoris can split into two little strands more up here at the top. So this is going to feel turned over. This will feel like that. So we get that, and then we're going to get this gradual movement here over, here over, here over, here over. Here we go. And then we're going to come down with that tendon. We're going to come over this condyle a little bit, and we're going to come over that patella region. All these will share that area. Nice and cleaned up. Remember, we have meniscus in through here, right? We don't want to forget our meniscus discs, both lateral and this one's the medial one in through here. The actual would be back in through here. So those discs would be right in through there, sitting on there, right? Okay, patella way over, edge in through there. Okay, get that edge and back in perspective. Okay, we have that. Okay, so that's working for us nicely. So now we want to feel, what do we want to feel next? Probably the sartorius. So the sartorius would come here, be right up in through here. Remember right here. at the crest over here on the more medial side, because the tensor fascia lata we won't see on the other side, right in through here, coming over and latching over, okay, like so. And it might get buried with the abductors, but it might make its appearance. It's going to attach down here, remember here, right? Right over and through here. It's going to attach over here. It might make its famous appearance right in through here with the gracilis muscle, okay? Right in through, should draw this now brown over here. You can start to see it a little bit, this area. Turn nice and broadly, this might pop out, pooch out a little bit and then come over, like so, okay? And then be probably a little bit higher. So I'm gonna reposition it higher. Attaching it and through here, maybe the other strand of it down and through here. That looks a little bit better for design. There's our strand, our strap for our sartorius muscle right in through. It looks like we can get in through there. Maybe we could get this to come down a little. Box out. These muscles are rounded, they're also really kind of boxy too. So as we come up, we feel the rectus femoris, and through here we might start to get now just this tendon of the, of the tensor fascia lata, the iliotibial tract, sorry about that, coming over in through here, maybe just a little bit more of that, and then we might feel a little of this condyle back in through here coming over the tibia. There we start to feel pretty good about what's going on. In through here. This is really going to pull this way and then whoop, go around that way quite a bit. So this might pull underneath. All right, so now coming over here, we've got the abductors and the biceps, no, actually the semi-tendinous and semi-membranous muscle. Remember those flexors in the back? Clean this up a little bit, right in through there. So the back part now of the condyle of the tibia, okay, we won't see that much of it, but right in through here, this is not the abductor, this is the semi-tendinous and semi-membranous right in through here, really stretching over. So they're going to go underneath. Now if this is male or female, the genitalia could be here and they would start to sit underneath right in through. I'll just kind of indicate it and that's all we need, I think, for now. I don't think we need a lecture about that part. I think everybody's got that down. Okay, so we're going to feel this semi-tendinous and membranous muscle together. And through here, this will be the semi-membranous, and then the tendinous here. Or on the outside, they're going to come up through here, okay, like so. And then they're going to sheath down and connect back behind. Remember on the back part, and down the side of that condyle. Right, this will give it probably this a little bit more of a bulky appearance right in through there. So we can feel that now coming through. That's not the abductor. So let's make sure that we know that that's the case. These are the flexors in the back there. We'll see them emerge back and through. Also notice that they create a nice aspect, again moving in this direction with the leg. So I would say I would take my design from my imaginary model and actually pop this out here just a little bit more coming down, just to pop this whole aspect. This could be bulgier, right? In through here, see that? Just a touch, just to make that really work for us, so we can pull this up and around. So let's work on those abductors, okay? Of the femur, working in this area. So we're coming across here. So remember, can we remember those a little bit? That's going to be tricky enough, right? So the first thing we want to work on, remember the iliopsoas muscle coming across here, sitting in now this fossa, okay, of the medial end here of the pelvic crest and through here. So that fossa sitting in through here. I'm not going to make a big move in through here. It's going to cascade. Remember, cascade down a little bit. Remember, it's going to hang on into that interior trochanter. That might be here in bulging. Probably get disappeared right in through here, but make a little appearance right through here and right through here. So we have that. That's pretty complex to think through. That's not easy for sure. This will sheathe across. So we're working on the inside now. We're seeing through our model. We've got the rectus femoris here attaching on the inside. Okay, and over like so. The next is we'll have a little gap between, and we'll have this little feeling now of the pectineus muscle. Okay, so it's coming down. Remember, it's going to attach down to the linea aspera of our femur bone, down and through and underneath. So we get a little bit of that probably coming through to its side aspect. So we have a little bit of that coming through there. Then we're going to get a little bit of the brevis, a little gap, and then we're going to get that longus, right? We're going to get the longus and getting down and through here a little bit further. Coming, so the attachment here, that longus, it's kind of a tube that's going to come out and bulge a little bit further, come all the way. Remember, the magnus is underneath almost all this. So we're going to get this pulling through, okay, and here. This is really going to flatten out for us this way. Okay, coming through here like so. Get that gap in between, so we have that brevis in between. We'll separate them out. Okay, iliopsoas muscle coming down. Okay, attaching to the lesser trochanter. Pectineus muscle, okay, in through here. Right. Roughly in through here, going back to the linea aspera. Same thing with the longus. In through here. And we're going to get now the longus head coming up almost to the end of the front of the, the tubercle and through here. There we go. Right in through there to keep it clear. And then we have a little bit of space where the magnus and the gracilis is going to attach right in through here and come on over. So it's a little band that's going to hug tight through all this. Right. This view, hug tight in through here. Okay, and then come up and over and down. Kind of meet up and underneath the sartorius and through there. Okay, and then attach down underneath it a little bit and through. And get lost, right in through, right into there. There we go. So then we're going to get now this underturn for the semi-tendinous and semi-membranous, and it'll start to disappear underneath the sartorius. And the vastus medialis obviously was, we'll bring it out just a little bit right in through here a little bit again. Coming down and through and over. Of course, get covered out by these other muscles. So I'm kind of allowing that to be buried a little bit, but this comes up, you get that direction, the sartorius and through there further. And we can kind of side plane out the patella, top headed here, get a little side plane in through there a little bit. So we have this tendon sartorius and the gracilis coming down through there. Working out pretty nicely now. Like gastrocnemius might come out and be through here and over, and we'll talk about that later on. You get a little condyle here, a little protrusion from the iliotibial tract and through here, and then get this bone muscle coming out and through like so. You might get something that looks like that. I could play around with that a little bit. All right, so we can clean this up a little bit here. Okay, So we have that. Now let's get a little bit of contour feeling, kind of diagrammatic, and get this in through here. Get this gracilis attaching right underneath here to the front. Cartilage right in through here. There's our bowl. Up in through here. Genitalia comes up and over now. Would hang over through here. Okay. This is bone of the foramen of the ischium in through here. Okay. So it's a nice interior view of that leg. Okay. So let's clean this up here a little bit where the rectus femoris is. Tendon coming in through here, coming in through here, heading over, tendon down and over and around. Feel that. This would bulge a little bit, kind of pocket in. So we feel this. So we feel this downward, like so. You might feel this coming over like this. Heading out a little bit here. So we can separate this out. So remember, we're learning for anatomy. When you go draw naturally, you draw what you see, and this will help inform you of what we're getting from our model, from the human form. And you want to control anatomy. You don't want it to control you. So there are times when you can delay an anatomical feature for effect. So let's get now some, this design feels pretty good. Let's get some contouring lines. So this really will want to come across here, right? And we get this ridging downward and kind of in through here and over, okay, a little bit. This whole thing will want to come actually over, and then we'll want to come back underneath here, and of course back around. So here and over, here and over, here and over, this kind of thing. So we come here, okay? Then an underneathing here, like so. Then we'll come around and over, and then back underneath the model, right in through here. This might turn to here. To clean in, all this might be in shadow. I'll put this in kind of an orangey sort of shadow, and this might get into 11 to the soleus down through here. This might feel like this, like so. Get a little contour line expression coming up underneath here. This comes out. So, gracilis, longus in through here, right in this little gap, and then, excuse me, magnus, and then the longus here. A little bit of gap with the brevis pectineus in through here. Three-fingered gap, the straighter part of the leg before we get bulging up to the sartorius. Tensor fascia lata. This might help bulge. Would you get maybe a little bit of that and through here over to help bulge the oblique out through here. The three-finger gap where our leg gets straight, where you can stretch that out. And I think we've got everything we need now. I'm going to leave this just as a hollow now, where we kind of put it all together. We know that that's the oblique and through here, straightened by the glute, biceps femoris a little bit, and through there the rectus femoris down and over. We know that tendon, so that'll get bulgy and straight and over, right? Iliotibial tract in through here, biceps femoris, back and through, back over and through there. And I think we've got what we need now for this study. Here we go. So there you go. It's a pretty complex little thing to think through, but the more you do of these, well, you really start to see anatomy emerge through, and you can control it further. And as I go through this anatomy series further and further, I'll use different materials. For those of you that are a little bit more agile in other media, that might help too. So I'll take the time to work on this a little bit. This might be a little lighter. This would bulge through a little bit. This medialis might come through a little bit lower. Let's bring that head a little bit lower, like that. Really, we'll get to see partial amounts of it underneath the sartorius area. There we go. Something like that looks pretty. Looks like a better design. It's all just based on experience. And this might actually go up a little higher and through there, coming over and attach over to that lower end of the trochanter on the other side. Been through this and then through here. There we go. I think that looks pretty fair. Not bad. Pretty good. Okay. All right. I think we can go on. We'll do one more. We'll take that on. All right, let's do another study, and let's do something maybe a little different here. Let's see. So I'm going to think about an idea of maybe pulling the pelvis down kind of like this. I kind of start this way. So I want the figure maybe to recline and sit back and let the legs come out and maybe up. We haven't seen that view before, so that might be interesting. So we'll take our pelvis idea and maybe we'll put it over here. Let me come out with the camera just a little bit so you can see that. There we go. All right, so we'll take that idea. So maybe this pelvis will be maybe a little bit lower down in through here a little bit, and then we can come out. So kind of think of it sort of kind of like this, actually. Pushed out a little bit, maybe a little bit smaller. Make sure we get the idea I'm thinking about in my head. And then we have the bowl part of it and through, kind of curving around, kind of like in through here and then around. Okay, so we have that idea to get the ball rolling a little bit. Then that might push us now through the ilium and then down over to the pubic bone and then up. We could start to say, okay, here's our pubic bone up and over here. Center, this would be the center, and then around, kind of that tube. It comes over, remember we've seen that before. Around like so. And then we'll come around. Okay, now we're going to feel the ilium here. Shade this over, so we're feeling that open bowl a little bit. Something like that maybe. Okay, and then coming around. So we're going to feel this pelvic area a little bit further. Here's the top of the crest. In through here. Feel that coming around. Okay. So we'll feel this nicely coming over and downward. And this way, this might need, now we're on the top. Look and see seeing down the sacrum a little bit and over here, and over. Coming through, this might feel like it's going to go this way. Okay. That's the middle part. We have the sacrum coming in here. Kind of get them blunted and down through. The end of the sacrum, I'll just kind of make a little general point through there. Like so. This would go in the belly of it. So now coming on the other side, over through here and around. Lumbar vertebrae might be over in through here a little bit. You see that. And now this ilial wing, the ilium would come out maybe a little bit more. Okay, so we're feeling that out here. And a little bit further through and around to get that bowl form. And through here and down. Get a little bit of that ischium coming through and around, like so. There we go. A lot of this will be covered up, but we're going to show it anyway. Be covered up by the back. And coming up to the end of the crest, we'll bring that over to here, right? Through there, to here, to the top of the superior part of the crest into here. And then over and down to the inferior part of the lower part up through. So those we're working up through in perspective, okay, and then back over. All right, so we can now, we've got that a little laid in. We'll kind of feel this coming in through and down through here. Just feel this over a little bit like so. Okay, so we've got our pelvic unit down through this. Might actually, we might feel a little bit of the, on the outside and through here, a little bit of the ischium coming down a little bit this way to the foramen over. Remember at 45 outward, but down from outward and through here. So we'd feel that and then downward this way. There we go. Okay. Feel that cartilage in there, that center cartilage. All right, so let's maybe feel a leg now coming down and over. So maybe one can do this. So we know that we'd have the abductors maybe doing this a little bit. So we might feel like that might work for us here, like so. So I'm going to feel the tube of the whole thing first. It could be like a box, downward, okay. And then over this way, kind of the glute would come around a little bit. Buttock maybe would see. Maybe a little bit more to the side a little bit, something like that. And then over and up and through here, okay, and then maybe the calf would come down here and we'd get the bottom of the foot maybe somewhere, I don't know, down and through, down and through like that, something kind of like that. So we have that. And then maybe we can get the other leg to sit down. So we'd see this is the rectus abdominis would attach right in through here and out in this way. I'll show you that. And so maybe the other leg, we'd get this maybe pubic region outward here. Let's see, up, we gesture here, up and towards us just a little bit. Let's see, maybe through here, so we'll just figure this out a little bit. Okay, maybe that would be bent over a little bit more, probably a little bit more back in through here, up a little bit higher, if possible. Okay, so maybe something like that. So you can see where I'm just feeling out what we could do through here. The legs, so something maybe like this and over. Might be an interesting view. Maybe get a little bit of the gesture coming through like that and around. This would be up and oblique over the top and up and towards us. Might be interesting. All right, so I've got something to work with there. Okay. So now let's see what we can do. Let's think about now bones first as we practice a little bit of this anatomy coming through. And so the acetabulum would be hidden back in through here, roughly. We're looking through this area. If we came across, we'd feel that, like so, about roughly, probably a little bit higher up, about right in through there. So that's what I'm drawing there, the acetabulum here as a kind of a cylinder tube all the way through, just to get a feeling from it. So we see the ball socket here, maybe right in through here, of the head of the femur coming through, and the trochanter downward, like so, and out a little bit. Probably not protruding that much out. Then we're going to get that head of the trochanter. Now we're at the top, so we're a lot like this. Okay, so we're drawing, you can kind of see what we're drawing here now to make this better visible, kind of like this and downward. So we've got to feel that coming down and then up. So we have that head, that hitched kind of head in through here, right? Like so. And then we have this trochanter base, just kind of a blocky form. And then we're going to come down now and come around and over. This could actually feel underneath and through. We're going to get this feeling of this bone coming down. Okay. And a little bit wider, so we're going to get that condyle now right in through here. So we're going to get this here. Now we're not going to see any of the condyles because we're above them looking down, but we're going to get kind of this view, right, looking down and shafted a little bit like that. So we'll take that bone here, we'll come over this, we might see a little bit of the underturning here, and over there to get a little of the condyle, okay, like so. And we know that the kind of gets triangular, right, as we come through. So we would feel this in through here and over. So it'll be challenging view a little bit. Maybe this way as it leans over. We'll push it a little bit. So I'll blur this to get us back on the right track. Through here, and through here with the bone. Up and over to the trochanter, down and through there, and there we are. A little bit smaller in through here. So we've got our femur now emerging. Patella we might see up. Let's see. I'm trying to think here. About floating up above. Okay, right in through there. And underneath is that. The head of that, so we'll bring that, pull that back in, so we have that bone. And it's going to get significantly thinner now as we come down and through, so we're up through to that leg. So now we can think about now attaching muscular form to our femur here. Shall we maybe go ahead and get both of them, both the bones in, so we see the ball socket here, the femur merge of the neck here, right? And then the trochanter out, boxed out like this, hidden of course underneath all the scapula, underneath through there. So it's a lot of thinking to do. It's quite a bit of thinking to do. Then we're going to come down, if it's pushed up, this leg might even be further out over and through here, like so. So this would come down and emerge already upward, give a little bit of an arc in through here, up and through, and you kind of I kind of see it like this, right? And then it's going to kind of emerge like this. We're going to get a little bit of that side in through here and kind of merge up a little bit, like so. And it'll be a raised, kind of see it as raised up over this one a little bit. It's a pretty challenging little view to see. Okay, so we have that. We get this side kind of view of the leg in through here, like so. So there's our box coming over. Right in through here we get, I'll show you where the patella could be. So we get this boxed over and then rounded. Remember, this is going to come back and through, club over, right? Come through here a little bit. Come on down, and we get the condyle split here, like so. We get that coming through, up and over, and there we go. A little bit of that arc. And I think we've got something to work with. So notice how I'm working with it, and I'm changing my look of my leg as I go through. So now we have the patella, which will roughly be here and over. And sit over that. Hang on to. And then we have the down and through the club look. So like that. Then we're going to have the tibia now inside here downward. Okay. And shafted down. This is going to go off in this direction. This point in time. Could be leaning off, so both legs are up in the air a little bit. Okay, so we have that. That's about all we'd see coming through. This will get shaped downward, and this is where that tuberosity would be roughly right in through there to get us over. We won't see the fibia back in this direction. So there we have the tibia in that direction. Maybe we could get a little bit of the calf would feel like this would flatten here, coming around overlapped. This is going to come over, and we get that feeling back up and through like so. All right, so now we're kind of cooking a little bit with some anatomy. I feel like this is a little wide in through here, so we can come back in through and say, okay, this thigh could be here and up and over. Now I can feel that. I would feel maybe right over that. This is going to feel down. You can start to feel that. Later on, we're going to feel those abductors, right? Coming in through and over. So we can start to feel that part merge. And this will feel abducting right in through. Right, and over, let's see, over, like so, and back into the anatomy there. Excuse me. All right, so that's hard work just to get to that point. It's good exercise of your drawing faculties to see what we can accomplish through here. So we've got that. We might see the buttock now merging over and through here, and of course it's going to come all the way from over here, sheath around. All right, now let's get really clear with our anatomy and see we have the back would come out so something like that with the figure. All right, let's get clear now and let's make something happen with more of our anatomy. All right, so to recapture our pelvic unit here, we're going to see this middle section. This is going to start to fall down. So rectus abdominis here, coming out like a belly, out this way. Now it's going to get wider, coming outward and over this way. That's all we'll show. So let's start to add on now some muscle. The rectus femoris, from the secondary crest point here, the inferior part of the spine of the pelvis, right in through here. We know that rectus femoris attaching onto here, and it's going to be moving across and over, right, to the muscle here, probably a little bit more, I'd say, to here. So let's work that there and over this way. Start to feel that through. And it's going to attach onto here. So we have that, and then we're going to get that tendon, maybe just a little bit longer, just a little bit through, and then that tendon is going to attach downward and onto that patella, wrap around that patella. That's all we're going to see there. Of course, it would go back to the patellar ligament back behind it. Okay, there. So this might come across like so. So we've got that moving. All right, so we're moving and grooving with that. Hit that. More tendon here, and a little beefier and deeper in through these areas and down and over. There we go. Sheathing over. So let's now take the vastus lateralis over here. So we can kind of, I've already seen I've implied it over here. And that's attaching right underneath that trochanter, right? Remember, right in through there. It's pretty implied already. The line on that bone, so it's going to sit underneath and actually over a little bit further, lateralis, and it might get a little bit wider now here as it comes out and through, and then it starts to get more narrower and head out and head in through here with its head, a little darker part of the head in through here. So now we have the vastus lateralis. Feeling that through and through here, and then get a little bit of a split going right in through there. And of course the vastus intermedius is underneath that rectus femoris area, underneath and through here. So we get that muscle now, and so we get this turning, don't we, already of the form. pretty nicely so far as we're going through there. Now the glute over here, we could say, how are we going to feel that out? Let's see. Okay, so how are we going to do this? Well, not bad. Remember, it's the rectus medialis is right here. I'm not going to draw it too much, but it's here. It's attaching to that trochanter, right in through there, right? Okay, and then from the top of the anterior superior part of the pelvis, the tensor fasciae latatus, attaching right in through here, isn't it? Right in through the sartorius will be coming from right there. I'll draw that in a moment. I'll get it headed out in the right direction so we might see that. I'm trying to draw as many muscles as I can. Then we get the glute, because I want to get the glute in there. It's going to be important. We get that glute coming over in through here. Now it might get covered up by the back, but I want to draw the whole thing. Right in through here, down and over, sheathing over here, and then get squeezed right in through here since it's kind of laying down. And then we'd see it right really under squeezed here and then here. Draw even flat coming back this way. Okay, so we're coming back now down and around and over in directional flow that way. Okay, so we have that. And then this is going to pull down all these fibers across. We just see all that. Start to cover up all this now. We've been through that. We've seen it. Tensor in through here. Okay. A little bit wider. Coming over. Then we have the buttock region really wrapping around. And it's going to wrap now underneath. Okay. And go underneath. And we want to get back to that, but that bone, part of the trochanter, but underneath that rough line or linea aspera underneath. And so here's our femur, right? Here was our femur. It's all covered up now. So underneath that, on the bottom part, underneath that back side, this would move and come up underneath that. See how that works out? So that's quite a strong little construction. So we have this moving, working for us here. Grab another color maybe. See what we've got. Set this down a little bit. There we go. Kind of a violet. So you might get that look with the glutes here. And then running around it over through there. Looks pretty good. And check my design. This might be a little rounded. It could be a little flatter. So it comes through and over. Now in the trochanter now, we want to pop this through. So it's right here. So that's going to be a little exposed, that structure. This is going to come across and over. This will get pretty wide. This will be a little bit of a bony protrusion. And we get underneath that a little bit. Get this feeling underneath of the glute and through here and then back over and under and around. Okay, it's going to be important to see that bony protrusion up here. Of course, that sits right nice and tight on the ground and through here. Okay. All right, so we got that. So we've got the glute, the tensor fasciae lata, just a little bit here, very, very foreshortened. Top of the box, coming in, down, kind of sheathing over it. Iliotibial tract would actually emerge and come back this way. But this guy is important. Top of that trochanter, in through here, this side, the bottom and through there. Now we wanted to put on, let's put on the sartorius. So the sartorius will move across, remember that banded muscle. So the gesture that's going to be across here, right? All the way over to here. It's going to kind of kiss around the medialis a little bit. So I'm going to gesture in the sartorius here and get that kind of that banded structure. And then I'll put the medialis. And the medialis starts from the base of the trochanter, the great trochanter, in through here. We won't see that a whole lot. Come underneath. Okay, in through here, you see a little bit of that tendon come over and start to emerge. Come on over, come on over, come on over. And then come on down here and then start to really get this bulkiness That's why I wanted to wait and put that on over in through here. Bulkiness over, square off on that knee, right in through. We see it right in through there. So we start to see that emerging. We can start to see this coming around. This part of the knee, patella in through there. Still got that forming through. And so we have that. Now let me get this medialis cleared up even further for us, right in through here now. And we're going to get this solid kind of rounding as the muscle form is going to also turn the leg this way. Around and around and around we go, like so. Get that deeper part, that femoris coming out and through here, that tendon. And of course that tendon now, we won't really see it in this position of the medialis, but it's going to coat over right in through, excuse me, right over and through there. So now we've got the sartorius in through here. Medialis might be a little bit more substantial. And I'm going to bring the sartorius now back from the base here of the spine of the anterior superior area. We're going to cascade back over a little tighter now up to it, right in through there. Up to it here and over. I like that better. That design right there a little better, so we'll take that out. Blur that out so you can see that this is going to pop out a little bit further and make that a little bit more of a protrusion. See that? A little bit. Yeah, I like that. I like that line better. You won't see its side because it's a band, kind of a belt. You won't see its side there. So we see that. And through here. Okay. Maybe this could be a little bit of a shadow. This is going to come around here and stop. Come underneath, and come out like that in terms of its sensitivity to kind of topographical feel. Now we've got the abductors. So remember, we've got the abductors here from the cartilage really on over. So the gracilis, right? Remember, they get the gracilis in through here, coming in underneath, attaching underneath and over. It's a real long belt-like muscle in itself. So this would be the end of the leg. Here would do this, so I can kind of follow my design. It's going to be really thin here and over, and it would disappear probably underneath, just like that. That can be pretty tough to see, right in through there, like so. Then we've got a little bit of that magnus space in between the adductor magnus, the largest of the muscle, in between here. Okay, all this will be covered up. Then the longus will be attaching slightly underneath and give you a cylindrical kind of head like this, okay? And then start to bulk outward like so and come over and attach to maybe a little bit more inward to the linea aspera and through that region and through here and over to this position over in through there. So this will really run around here like so. Okay, we have that. So we can clean this up a little bit. I'm going to go even a little bit wider in through here. There we go. Get this cleaned up so we can see that form. It's attaching out and over here underneath to the rough line of the pelvis, which would be right underneath the back part of the pelvis. Gracilis in through here. Got that. It's a lot to take in. There we go. Okay, so moving across the leg a little bit through here. Okay, then we'll catch this pelvis, the pelvic crest, in through here. There we go. And that's the foramen back in through here, FYI, just down through there, seeing it through there. Then we're going to catch now a little space in through here, okay? And that's going to be the brevis in between there, this little space in between here. Okay. Between there, and then we're going to catch now the pectineus over and through here, that kind of rectal, not rectal, but rectilinear, sorry about that. That's the right, should be back here. This kind of rectangular muscle form. And that's going to attach over kind of downward here. That would not be good. We have that coming through. A little light on that. Put a little bit of light so we can see all this jazz. There we go. And through here and over. Thinking of that coming through, and then we have the last one. Remember that we have a gap in between there. Okay. So have a little bit of muscle in between there. Okay, and then we also have a gap over here, and then we have the iliopsoas muscle, right, attaching all the way, sheathing underneath. And now the oblique goes on top and kind of underneath this, on top of where that white space still is left of the pelvic unit. But the iliopsoas, actually the psoas muscle is back here, and this actually attaches and comes up. I'll show you this around the spine. The lumbar and thoracic area, all the way in through here, and it just takes all this and bows in through here. It's good to see it from this position, this foreshortened position. You want to draw in many different positions, even if you make crummy drawings for a while. That's okay, I did, and because they can get hard. It can be really tough to see all this, but it's a good exercise in learning to see these muscle forms in different foreshortened positions. Very much so. So we see that over. Just going to clear this up by edges. Edges are so important. This is the anterior superior spine part, a little bit wider and through there. Okay. So the iliopsoas muscle here, I'm just going to kind of curve it around like this. Coming through. Now it comes down, remember, comes over and attaches. It's hard to see the lesser trochanter, but it's over here, and it's actually right in this, let's see, coming down and through would be right about in this area. So this would cascade down now, cascade down a little bit. Okay. I'm going to get that little gap part in through there. It's going to cascade in and over, so let's show that with a little bit more dark. Line in through here, and we'll fill that in. Put around and through. Gonna have to go darker as it works through. Like so. Make this a little bit of a shadow. Little shadow in through here. This is gonna flow out, gonna come through here and disappear inside there and connect down into all that goodness, that mess, right? Okay, so I think we've got a leg going pretty well. Now, I see where my gracilis is. Now, there could be fat pockets to make this more substantial, but I'm going to end the leg by the gracilis to get all that working for us. So we have that to work with. And it's kind of, what I mean by that is the outer edge of the leg. I'm sorry, that can be a little confusing. This is going to bulge a little bit, the vastus in through here, a little bulge. Come down and over so we can start to feel the rectus femoris. I'll just use this coloring and contouring here around. Get that feeling, and then it kind of blocks off a little bit, kind of running through. This is a little bit more of a blocking, but it's not a real strong definitive kind of plane through there. Through. Okay, so we got that working for us. And then back here we get a little bit now more of the calf, probably here, coming down to the tibia, fibia, and through here, and then just get the the basics of the triangular shaft of the foot through here and over into the toe. Toes coming out and through that area, so we get that feeling through. So let me bring this out a little bit further. And that's all I'm going to leave of that calf through there. That'll be enough. Push this back. Okay. So we're working. It looks like it's working pretty good now. So we'll come through the glute. Trochanter, let me bring that out. I'll bring out a little chalk, pop that out just a little. Pop that trochanter out. So that iliopsoas muscle, how about all the way up here, and it fingers up actually. It actually fingers up here, then comes up and attaches to some of the cartilage and transverse process, believe it or not, up and through here and around. It's pretty wild. It's really challenging to draw it foreshortened. It kind of comes up and does that. So let's get some topographic lines here and show you what's going on with this leg a little bit. So it's coming over this way, okay, squeezing over here, kind of flattens out, and comes up and over, and then starts to come on down and down through, and then out the side there. So this is an important little delineation. Rectus femoris through here, and then we get over here to the medialis. It's our longest here. That makes that deeper kind of turn over here, closer to the patella, that medialis. That's what I mean by that. So we got that 3 steps with the femoris muscle being the highest up the leg in through there, and of course the vastus lateralis. So this is like 1, 2, 3 step all the way down, like a how would we say, a stairwell. Sorry about that. Yeah, stairwell sounds good. So let me clean up the pelvis over here a little bit. Through here, okay, and over. Got the sacrum through here, the pelvis on this side. Over and through here, so we've got the gaping sort of bowl part up through here. Okay. All right, sacrum back to here. Coccyx kind of pointing up and through. Let's work on this other leg, right? That's already enough work over here. Let's do the other one. So we're working with some length in the foreshortening, right? Which is good to see. You're going to see that. And let's work on this other side. So let's work this out. Let's start with, I like to start with the rectus femoris. Where does it go to? Remember, it goes to that secondary cresting spine part, the inferior part now of the anterior crest, which is right around in through here. Bring it over, back, let's catch it back. Okay, it's right in through here, coming up to that first ridge before the second one, right, comes up to the final spinal crest and through here, right? So there's the final one, the superior one. And then the inferior is right there. So that's where that rectus femoris is going to attach to. Now, we got some interesting things going on, because we've got some foreshortening to work with. So you're going to find that this muscle here can bulge in and actually feel like this. Let's see, I'll show you. So it's going to feel a lot like coming in through here, bulging in through, and then out, okay, and here and up, and get pretty big pretty quick, but it's got to come over this way and over. So it's going to do this. A little bit more here, then block, and then kind of block out into like this. Okay, just sitting on top of the vastus intermedius underneath it, and then do this on the side over here like so, and then come around. So we're going to get something that's going to look a lot like that, and that's already pretty wild. So we're going to get that across. So far, downward. Like that. And then of course it's going to take on the tendon, that long tendon, maybe a little bit more. Through here and then downward, like so. It's peeking back at us, so we'll see a little bit of that. Then we're going to get this coming through and over. That tendon now, touching now on the patella in this direction over, and it's going to be right now on the side of this, in through there. So we're going to get a very strong feeling of boxing this out and through here with this turning right in through here and over. Kind of this pinwheel turning effect here. Keep it simple. Right in through there. Tendon over to the patella, side view, and then back on in there. You're going to get that feeling there. All right, so on the other side, you're not going to see much more. You might see a little bit of the medialis, no, excuse me, the lateralis in here, but probably more so iliotibial tract. And then you're going to get into the ending of the condyle on the opposite side over there of the tibia and the fibia. And the condyle of the, not even the tibia, the fibia, but the condyle of the femur right in through there for sure. So you get that turning there like so. And the femur, rectus femoris head and through there. And coming on through, let me go back to brown. I'm running out of brown here. Let me sharpen that. We'll keep talking through. So we want to be consistent in our technique and our craft. And we want to think through these muscles. And what really helped is to get an idea in your head and get that shape going of the outside form. So we've got this, and I feel like that's not going to be enough out and through here. So what would be out, coming out here a little bit? We wouldn't see the buttock much. We might see it over here. And that's probably all we're going to give the glute, because it would kind of wrap around and really just be hidden in through there. But that, there's some limitations we would have there. Coming over tensor fascia lata in through here. Little gap in between, up here at the top of the crest and over. We probably get that like so coming down. And so we get this little area in through here. Yeah, 3-finger gap right in through this area, and it's over here. Coming over, and then we might get a little wide, so we might get a little bit of the vastus lateralis in through here, and it might bulge, kind of like I had it, and come back in. It will probably disappear and come back. On the other side is the iliotibial tract. So we get that in through. Yeah, looks like we get that. That looks like a pretty good shape. And I say that because it's an estimation, just based on some experience too as well. So we get this now with the rectus femoris, and this is really right in through here actually. This, let me show you this. This just looks more like, this would be more of a side view. Maybe even, yeah, maybe even to here and over. So we're getting more of that as a side. This would turn like so. I'm just going to put all this in shadow. Hold on a second. There we go. Take that better. Let me show you that better. Here. There we go. That's it. Get a little bit flatter here. Take my dark, show you that coming through. That's it. And downward, that side view plane. So it's very much sliding across, and this has got the side plane of the boxy kind of wheeled form that I've got concepted for that area of the leg. Now, right in through here now, we're going to get that feeling kind of through. We still have the sartorius, right? So we have the sartorius coming from back over here, way over here, this back edge. Okay, it's going to come over. Okay, it's going to come over here. It's going to come down all these adductor muscles and through here, and you can kind of really feel it as it gets to that wider fullness, and it's going to come over here and come down. Remember, it's going to attach to the tibia, right up and through here on this side, and get pretty wide in this view. Actually, it's going to get pretty wide and wild. So it's going to make a pretty nifty little appearance right in through here. Here we go. So we have that coming through. We're going to get the medialis. I've got to get that in there as well, coming down. This sartorius would connect, turn around through here. So let's get the medialis now. Medialis will attach to, remember, the base of the trochanter, so down and through here. Okay, so down in this area, this is where the lateralis would come from, so make sure that's clear. Down in through this area with the medialis, so it's going to come through, right, and over and stay snug to the sartorius, and then make an appearance about, I don't know, right in through, yeah, really right at the, not quite, but not the base, in through here. So then we got the medialis, the medial part in through, right in, roughly right in through there, so they meet together. So we'd see that coming through. This might make a strong case for shadow maybe here. So we put that in. Okay, right in through here. So you staying with me? This is not an easy one. I haven't done a lot of thinking. You won't have to think this hard when you just draw the figure. But you're reinforcing your anatomical knowledge to draw even more successful figures through here, or whatever you're going to be doing. So now we have coming up, let's see, we have, excuse me, the semi-tendinous and semi-membranous coming up through here and over. Okay, so we get a little back of that. Now the gracilis is going to come over. That's going to come up, all right, and that's going to attach more in the back, way back underneath. But we're going to feel this little bulkiness right in through here of that muscle, semi-tendinous and semi-membranous running through here. So now it's time to put on those abductors too. So that's going to give us some fullness. Maybe not even that full that quick, but it's going to give us some fullness in through here with the abductors. So the abductors are going to be coming, let's make sure I clean this up, right in through here's the cartilage. Right in through here, here's the pubic symphysis. To be clear a little bit, coming on up through here. Push all that back in shadow for now. Okay, so getting into the abductor range and through the adductor range and through here. So coming up, let's go with the iliopsoas first. Remember, it was over here. Now it's going to be coming to the other side. It's going to come around, okay, coming on over here. Psoas muscle, the iliopsoas. So here you don't really need to know it as much. I'm really overdrawing knowledge. I'm not trying to show off. I'm just trying to show you where that muscle is really coming from. All the way it's hooking into this fossa of the pelvis in the inner part of the fossa. I love saying fossa. The inner fossa. Pretty weird. Like that. Through here. Okay. Connects around and through. Right through. Here we go. Just draw the base of that lumbar spine in through here. So it's moving now this way. Okay. Moving through, and it's going to attach underneath, right, the lesser trochanter. So it's just going to fall gracefully over here, fall away underneath, and just kind of move away and really get foreshortened. So it's going to do buckle here and come back and just split into kind of a two-head, ilio and the psoas. Staying through. Like so, like that. And really attach on over through. So get kind of bulky. Same thing over here. Here we could see it a little bit better. This actually could get a little bit bulkier. And through there. So we have that now. And let me cover this a little bit more so we see that. Okay, so we have that now coming through a little bit, making an appearance, making it hopefully a little clearer. Okay. And remember that attaches to the lesser trochanter. Now we have, we'll start from the other side and work our way through the gracilis muscles. So now we're working the gracilis on the outside and through here. You'd see it here very gingerly coming up and through here. Not on the base down and through here, but it's going to come up and be here, attached pretty tight and hug in, and be up and disappear and attach roughly around the same area as the sartorius muscle. So through and over, gracilis muscle, through here and over, and they have a little bit of a thickness showing, like so. There we go. So there's the gracilis. So we'll put all this like a little shadow here. And then what's left over here is the semi-tendinous and membranous muscle coming all the way down, back up to the pubic symphysis, the ischial tuberosity, which will be way back up, over and underneath, in through. I'll just point to it right, roughly. Look at that. See how it watches up pretty well when you got it right in through there. How about that for just craziness, drawing inside out. This might be a little challenging, but I think it's totally handleable if you can take it slowly. Through there, okay, so the gracilis, semi-tendinous and membranous, okay, so gracilis, and then we have some of the magnus showing through. We get a little separation and through here like so. The longest now, they're attaching up here but underneath, so it's coming over, so we get the longest here. It's going to get wider as attaching as it's heading down to the back of the femur over like so. You're going to get this kind of probably pocking and pulling in through here, so that's the longest, and it's coming up up in through here. In between is the magnus, right in through there. Underneath it, it's really big adductor muscle right in through there. There we go. It's really crazy, isn't it, to get all that going? I hear you. It's good for studying, for understanding. Okay. Try to pull this out a little bit further. So we have the the longus in through here. This is going to sheath over like so. This would make a shadow all over all that, really. That's that muscle right into here, the adductor longus. Like that. Okay. Let's get the dark one back in through here. Longus, like a tube. And really getting a thinner tendinous, and it would come tendinous area, and it would come all the way up and over and underneath and attach roughly right in through around the gracilis and through there. So then we have a little space there for the brevis, okay, right in through here and underneath, kind of like the magnus underneath here, brevis, and then we get the pectineus right in through and going down again, about like that, to the linea aspera underneath. Sartorius, remember, right in through here, coming up and through and over, so that's good. I'm going to take that off, that will be there. On top of that, we'll clean that up in a moment. Then we get the pectineus this, coming across. Little gap in between there where the iliopsoas. Roughly is underneath there a little bit too. Right through there. Sartorius now attaching up and through there, and we're getting now a pretty nice shape. Looks like we're getting a pretty good thing going now with our forms. And so this tendon now, make sure the medialis is going to come over this pelvic, this patella region in through there. That's important to see. Right in through there. So let's work on now this final shape. So sartorius in through here. Let's get a little value on it. So it's really kind of a banded muscle, rectangular, like so. There we go. Okay. Get all those forms coming together. This would feel nice, maybe a cast shadow under here. Come back and maybe catch this calf, this gastrocnemius, back in through and back down. Catch the edge here, almost on that bone. There we go. And I think we've got what we needed out of that. That's pretty close in through there. Maybe I can add a little bit of maybe darker tone to show this off. Through here we can just get this straightened out. Show you there's separation. And through here. So you can see these forms emerge a little bit better with a little tone. These chalks are good. I'm working with carbothello mostly here to get that in through here. Semi-tendinous and membranous. Let's make this a little bit more definitive, bulky here, coming around and going back down underneath the glute, actually underneath there, and then the gracilis right in through there. So I think we've got all our parts now in order. It's a pretty tough view to work from, so you might want to work up to something like that. But the way I got good at this is part of practice. It's just doing these. Once you know the forms, starting to put them all together in little sections together. That will help. Here and over, patella, downward and through. In that region, I think we're good. Pretty good to go. All right, so keep on practicing. The next step will be to go on to some living diagrams, living studies from the model, and work that way too as well. Maybe I'll do a little dark here so we can see all that together. You can see this on this foot. Going through here, bring it up against that edge. All right, I think it concludes this one. So there we go. It's for living kind of diagrammatic models of the lower leg. Push that back a little bit. Okay, so now on to living studies from the model. Okay, I'll see you there. Take care. Bye-bye.